Hello everyone, I hope you all guys are good and doing well. In this video we are going to discuss about peptic ulcer disease. First of all, you need to know that what is peptic ulcer. It refers to a group of disorders which is characterized by circumscribed lesions of the mucosa of the upper GI tract, particularly the stomach and duodenum. Duodenum is the first part of small intestine, the second one is jejunum, and the third one is ileum. The lesions occur in regions exposed to the gastric juice. That means the lesions occur in that region which are well exposed with the juice, which is acidic in nature, secreted by some specific cells of the stomach. Okay, let's come towards other GI disorders. There are so many GI disorders, but the main three are GERD, NERD, and dyspepsia. These are most common disorders. The first one, GERD, which is gastroesophageal reflux disease, refers to the retrograde movement of gastric contents from the stomach into the esophagus. The best to describe this is, first of all, we know that there is esophagus, then stomach, and later on there is the small intestine, and the first part is duodenum. So this is the retrograde movement of gastric contents. Gastric contents means anything which is present in the stomach will move opposite. Normally it moves from upside to downside. Retrograde movement is from downside to upside. That means from stomach to esophagus. Reflux may occur without consequences and thus may be considered a normal physiological process, or it may lead to profound symptomatic or histological conditions, for example, GERD. When reflux leads to inflammation with or without erosions or ulceration of the esophagus, it is called reflux erosive esophagitis. Itis means inflammation. Whenever the word comes itis, it means inflammation. For example, hepatitis, inflammation of liver. Meningitis, inflammation of meninges that are present in the brain. You must know that. The next one is, most of the patients, that is 50% to 70%, report typical symptoms but lack evidence of esophageal mucosal injury, which is also known as NERD, non-erosive reflux disease. The third one and the most common one is dyspepsia. It is defined as persistence or recurrent abdominal pain or abdominal discomfort centered in the upper abdomen. Okay, now let's come towards the manifestations. There are so many manifestations, but few of them are duodenal ulcers, gastric ulcers, stress ulcers, Zollinger-Elleuin syndrome, stomal ulcers, drug-associated ulcers as the name prescribed, such as NSAIDs and steroids. The next one is pathology. The average size of duodenal ulcer is less than 1 centimeter in diameter. Average size of gastric ulcers should be 1 to 2.5 centimeter in diameter. The mucosa surrounding the ulcer typically is inflamed and edematous. Ulcers penetrate the muscularis propria and in some cases extends into the serosa or even into the pancreas. These are basically the layers. Fibrous tissues, granulation tissue, and necrotic debris form the ulcer base. During ulcer healing, a scar forms as epithelium from the edges covers the ulcer surface. Nearly all duodenal ulcers are benign, that is, location specified. Up to 10% of the gastric ulcers are malignant, that means they can move. Okay, let's come towards its major causes. Major causes of peptic ulcer disease are as follows. Number 1, NSAID induced. Number 2, gastroduodenal mucosal injury. And number 3, Helicobacter pylori infection. Helicobacter is basically a bacterium. The next one is, you are going to know about what is Helicobacter pylori, because it's an important question. You must know that. Helicobacter pylori is basically a bacterium which has so many flagellas for active movement. It secretes basically an enzyme which is known as the urease. Urease specifically hydrolyze urea, as the name indicates, urea into ammonia. Ammonia is basic in nature, and we know that the gastric juice which is present inside the stomach has a pH of 2. That means it has strong acidic pH. Ammonia basically neutralizes that gastric juice in the stomach and creating a neutral cloud surrounding the organism. Okay, let's come towards how H. pylori affects gastric mucosa, as I have told you before, how it neutralizes. So the next one is the treatment of H. pylori, which is very important, as it is very common in everybody. So its treatment is very important. The US FDA and international organizations have approved several triple therapy for the treatment of H. pylori infections in patients with gastric and duodenal ulcer disease, such as number 1 is the OAC. O stands for omeprazole, A stands for amoxicillin, and C stands for clarithromycin. This is for 10 days. Similarly, LAC, lansoprazole, amoxicillin, and clarithromycin for 10 to or 14 days. The next one is the BMT, bismuth subsalicylate, metronidazole, tetracycline for 14 days. Let's come towards the next slide, which is a risk factor. Smoking is a risk factor. Smokers have an increased risk of developing peptic ulcer disease. In addition to that, cigarette smoking delays ulcer healing and increases the risk and rapidity of relapse after the ulcer heals. Nicotine decreases biliary and pancreatic bicarbonate secretions. Smoking also accelerates the emptying of stomach acid into the duodenum. Okay, the next point is drug-induced peptic ulcer disease. Number 1 is coffee. Both regular and decaffeinated coffee contain peptides that stimulate release of gastrin. Gastrin is basically a hormone that triggers the flow of gastric juice. However, a direct link between coffee and peptic ulcer disease has not been proven. Number 2 is corticosteroids. Current data support no link between steroids and peptic ulcer disease in the absence of concurrent NSAID use. The next one is drugs which are used to treat peptic ulcer disorder. Number 1 is the antacids. Aluminium hydroxides, magnesium hydroxide, and simethicone. Number 2 are the H2 receptor antagonists. Number 1 is cimetidine, number 2 is ranitidine, number 3 is famotidine, and number 4 is nizatidine. Number 3 main drug is scrolfate, and then GI anticholinergics, prostaglandins, proton pump inhibitors such as omeprazole, etc., and bismuth compounds such as bismuth subsalicylates. The next one is algorithm guideline. You can have a look on this. It will be very beneficial to you if you are going to appear in any exam which is related to your pharmacy as well as which is related to your MBBS like FCPS, this guideline is very important. So if you want to get more interesting videos about any topic, you can let us know in the comment section. Till then, take care of yourself. See you soon.